And autumn is usually when hay fever sufferers can take a bit of a sigh of relief, but this year millions could experience ongoing symptoms.
Yeah, experts have warned that intense pollen season could mean allergies continue well into autumn. But how do you manage those symptoms? Well, Dr Zoe is here, thank goodness. Why? Why autumn?
Well, it used to be that the hay fever season ended in September, and it used to end with grass and weed pollens. But we're seeing the hay fever season get longer and longer, largely due to climate change. Temperatures are higher, but also because of more CO2 emissions. They feed a lot of these plants and you know, so climate change is responsible for it getting longer, and over the last 3 decades it's increased by about 20 days. So it is now tipping over into October for some people, which is a nightmare if you're a severe hay fever sufferer.
Yeah.
What about things like dust mites and mould and that sort of stuff?
Yeah, so sadly, allergies don't end with the hay fever season as well. So things like mould and dust mite can affect people all year round. And actually in sort of October, November, mould can become more of an issue. So mould is a type of fungus, and fungi love moist and warm temperatures. So I think, you know, as it tends to be a slightly damp couple of months, mould can really thrive. And also, because it's quite windy, those mould spores can get into your home, can be around, and people can breathe them in. So that can cause allergies, so very similar to hay fever symptoms. It can also exacerbate asthma. It can increase the risk of lung infections and other lung diseases as well. So mould can be a real issue.
Can you do anything to sort of minimise the symptoms?
Yeah, so anywhere where mould is growing, you can try and remove it from your space. So things like leaves. If leaves are falling off the trees, especially if you've got them in the garden, try and get rid of them. Mould loves to live on those leaves. If you have a compost bin, try and have the closed type and have it as far away from the home if you can as possible. Whenever you're doing anything that creates moisture in the home, so cooking, showering, try and confine the moisture to that room. So close the doors in those rooms to confine it. And if you're working in a place or you're outside and there's either either pollen or mould that you think is getting on either pollen or mould that you think is getting into your hair, getting into your clothes, when you come inside, you know, try and do what you can to remove it.
Are the symptoms the same for sort of allergies to mould and mites as they would be for hay fever?
Tend to be very, very similar. So things like sneezing, itchy nose, watery eyes, you know, sometimes people lose their sense of smell. All of those symptoms tend to be similar for these types of allergies as well, and therefore similar medications work. So we often think of things like the over-the-counter non-sedating antihistamines, so that's cetirizine or loratadine. We think of them as hay fever medicines, but they treat all allergies. So antihistamines are usually the first port of call. You can think about using the nasal sprays as well. So steroid nasal sprays are very good. One tip about steroid nasal sprays, they take about 2 weeks to start working effectively. So I think sometimes people get these medicines, they're very effective medicines, try them for a few days, they don't help, and then they stop using them. So persist for a couple of weeks to get the full effect. And then eye drops as well if you have eye symptoms. So all of those can be got from the pharmacy without a prescription. And have a chat with your pharmacist as well. Let them know what symptoms you're having and let them know what you've tried before, because pharmacists are brilliant at guiding you and making sure you're not wasting your money, you're buying the right thing.
If you start something now, bearing in mind that, you know, we're probably coming to the, even though it's extended, probably coming to the end of the season.
Yeah.
Will it have stopped by the time they take effect?
Probably not. So I think if you're sensitive to mould, then we've got a couple of months, probably October, November, especially if the temperatures remain quite high, where that could affect you. When it gets much colder, people can still have trouble with mould in the home, especially if we're using central heating and things like that. But because it gets colder, then especially outside, then mould finds it more difficult to thrive.
You've got an air purifier as well.
Yeah, so things people can do in the home. Dehumidifiers obviously can be helpful, but also air purifiers are getting more popular. There are loads of them on the market. They vary in cost by quite a lot, but air purifiers, they cleanse the air. They take pollutants out of the air, they take irritants, and they take allergens out of the air as well, so they can eliminate things like viruses, bacteria and mould spores as well. So a couple of tips on if you are looking at buying an air purifier. 2 main things to look out for: something called the Clean Air Delivery Rate, CADR, and that is an indicator of how the volume of air that can be cleaned within a certain time frame. So the higher the number, the more air it's going to clean. So important, especially
to get the right size one for your right room.
A large room, yeah. And it's likely to be more expensive generally, the more effective it is. And then the filter, if it has a HEPA filter, HEPA, then that's the sort of gold standard filter. So sometimes they say HEPA style or HEPA light, but if it's actually a HEPA filter, then they're the best ones. But also have a think about how much noise it makes, especially if it's for a bedroom, and have a think about how energy efficient it is, which is really important at the moment. No, it's not. It's not plugged in.
I was just wondering how
quiet.
It was very quiet.
It would be very quiet if it was on.
How do you know if you haven't just got a cold? Like if you've got a runny nose, how do you know when it's a cold or when it's an allergy?
Difficult to know because most of the symptoms are similar. I think generally if you've got very severe eye symptoms, that will be the clue that it's more likely to be an allergy. But people do get eye symptoms with colds as well. I always say to my patients, the best if you aren't sure whether this is an allergy or a cold, take an antihistamine. If it works really effectively within a short space of time, then
you know
it's probably likely to be an allergy. Although, you know, antihistamines can help a little bit with colds as well.
And are we getting more prone to being allergic to the world we live in?
Yes. So over 30% generally of adults now are experiencing allergies, and in children it's as many as 50% of children are diagnosed with an allergy. So the rates of allergies are going up. There's lots of different causes. So there is this hypothesis that because children are growing up in cleaner environments, so they're not exposed to as many things that sort of train their immune system. So there's that hypothesis. But we know that pollution is a big indicator, climate change and lifestyles as well. You know, the fact that children don't tend to be as active, our diets have changed, we eat a lot more processed foods. All of these things impact our immune system, and that's not just our defence against things, but it's also our immune system overreacting. That's what allergies are. Allergies are our immune system behaving as though something is dangerous when it's not, like pollen.
And obviously COVID numbers are going up again. How do you know whether it's COVID symptoms or allergy symptoms?
You don't. This is the thing, because, again, the overlap is there and, you know, the symptoms, depending on the variant, are always changing, and the most predominant symptoms at the moment of COVID are a sore throat, a cough, blocked and runny nose, exactly the same as a cold and very, very similar to allergies. Sneezing tends to be more likely with a cold and less likely with COVID. So, you know, the advice really is colds are more common than COVID at the moment, but the only thing we can do is do tests, and until you know, just be very, very careful with what contact you're having with other people. Very difficult to determine. And
also, I suppose, in our last sort of 15 seconds, don't be so paranoid about germs with your kids.
I think so. I think, you know, let children live the life that you lived. You know, don't let them pick up dog dirt. That's going too far. But, you know, a little bit of dirt here and there. You don't need to have a completely sterile environment. It's not necessarily the right thing.
Thank you, Zoe.
Thank you. Thank you very much.